What if your body could send a warning before you ever felt sick, before the fever, before the pain, before the emergency room, before the diagnosis that changes everything? Imagine waking up one morning and getting a message from your health app. Your risk of heart failure has increased. Your blood sugar pattern suggests early diabetes. Your breathing data shows signs of infection. Please schedule a medical checkup. At first, it sounds impossible, but this is no longer just science fiction. Artificial intelligence is beginning to change one of the oldest rules in medicine. For centuries, healthcare has mostly been reactive. We wait until symptoms appear, we wait until the pain gets worse, we wait until something feels wrong, then we go to the doctor. But the future of healthcare may look completely different. In that future, AI may help doctors detect illness before symptoms appear, and that could change everything. For most of human history, medicine has worked like this. A person feels sick. They visit a doctor. The doctor asks questions. Tests are ordered. A diagnosis is made. Treatment begins. This system has saved millions of lives, but it has one major weakness. It often starts too late. Many dangerous diseases do not begin with obvious symptoms. Heart disease can grow silently for years. Diabetes can develop slowly before a person notices anything. Cancer can remain hidden in the body until it reaches a serious stage. Kidney disease, liver disease, neurological disorders, and infections can all progress quietly. By the time symptoms appear, the disease may already be advanced. That is the problem preventive healthcare is trying to solve. Instead of asking, how do we treat this disease after it appears? The new question is, can we detect the warning signs before the patient even feels sick? And this is where AI becomes powerful. A human doctor is incredibly skilled, but even the best doctor can only work with the information available in front of them. AI can look at massive amounts of data at the same time. It can analyze medical records, blood test results, heart rate patterns, sleep quality, breathing changes, genetic information, lifestyle data, medical images, wearable device signals, family history, hospital records, and then it can search for patterns too small, too complex, or too early for humans to notice. For example, a person's heart rate may look normal to them, but AI may notice that their resting heart rate has slowly increased over several weeks. Their sleep quality has dropped. Their oxygen levels are slightly changing. Their activity level is declining. Their breathing rate is different than usual. Individually, these signs may not look serious, but together, they may tell a story the human body is trying to whisper before it starts screaming. That is the power of AI in preventive healthcare. It does not just look for disease, it looks for direction. It asks, where is this person's health heading? One of the biggest reasons AI health prediction is becoming possible is the rise of wearable devices, smartwatches, fitness bands, smart rings, glucose monitors, heart monitors, sleep trackers. These devices collect health data every day, not once a year, not only during a hospital visit, but continuously. Your watch may know your heart rate, your sleep pattern, your activity level, your oxygen saturation, your stress level, your breathing rate. In the past, this data was mostly used for fitness. How many steps did you take? How many calories did you burn? How long did you sleep? But now with AI, the same data can become medical intelligence. A smartwatch may detect an irregular heartbeat. A glucose monitor may show early blood sugar problems. A sleep tracker may reveal signs of breathing trouble. A smart ring may detect temperature changes before a person realizes they are getting sick. This means the body may no longer be monitored only inside hospitals. The body may be monitored quietly every day in real life. The hospital may not be the first place where disease is discovered. Your own devices may become the first warning system. Now, the big question is, can AI really predict illness before symptoms appear? The answer is, in some areas, it is already beginning to happen. AI can help identify people at higher risk of heart disease by analyzing health records, cholesterol levels, blood pressure, weight, age, lifestyle, and family history. It can help predict diabetes risk by studying glucose patterns, diet, activity, and metabolic changes. It can help detect early signs of cancer in medical images, such as scans, x-rays, and mammograms. It can help identify patients who may be at risk of sepsis in hospitals before the condition becomes life-threatening. It can help predict hospital readmission risks. It can help analyze eye scans to detect signs of diabetic disease, high blood pressure, and other health conditions. It can help doctors understand which patients need attention sooner. But this does not mean AI is a magic crystal ball. It does not know the future. It calculates probability. It looks at patterns and says, this person may be at higher risk. This change may be important. This patient should be checked. This result should not be ignored. That difference matters. AI prediction is not the same as guaranteed diagnosis. It is an early signal, and in medicine, early signals can save lives. In the future, a doctor's visit may not begin when you say, I feel sick. It may begin with data. Imagine this. You walk into a clinic. Before the doctor even enters the room, AI has already reviewed your health history. It has compared your latest blood tests with your past results. It has checked your sleep changes, heart rate trends, activity level, medication history, and risk factors. Then it gives the doctor a simple summary. This patient's heart risk has increased over the last 6 months. Their blood sugar is trending upward. Their sleep disruption may be related to stress or breathing issues. The patient should be screened for early metabolic disease. The doctor is not replaced. The doctor is supported. Instead of spending most of the appointment searching through records, the doctor can spend more time understanding the person, more time asking better questions, more time explaining risks, more time building a prevention plan. This is one of the most important points about AI in healthcare. The best future is not AI instead of doctors. It is AI helping doctors see earlier, think faster, and act sooner. Today, many health recommendations are general. Eat better, sleep more, exercise regularly, reduce stress, check your blood pressure. These are important, but they are not always personal enough. AI could help create healthcare plans based on each person's unique body. Two people may have the same age and weight, but completely different risks. One person may be more likely to develop diabetes. Another may be more vulnerable to heart disease. Another may have genetic risk. Another may be affected more strongly by stress, sleep problems, or diet. AI can help personalize prevention. It can suggest who needs screening earlier, who needs lifestyle changes now, who should be monitored more closely, who may need a specialist, who may be safe with routine checkups. This could move healthcare from a one-size-fits-all model to a more personal model, a model where your care is based not only on your symptoms, but on your patterns, your history, your lifestyle, your risks, your body's own signals. That is the real promise of preventive healthcare, not just treating illness, but protecting health before illness takes control. So, can AI predict your illness before symptoms appear? In many cases, the answer may soon be yes. Not perfectly, not magically, not without doctors, but with enough data, careful design, and responsible use, AI may become one of the most powerful early warning systems in modern medicine. The future hospital may not begin at the emergency room door. It may begin quietly, inside your watch, inside your health record, inside a pattern only AI can see. And one day, the most important medical message you receive may not say, you are sick. It may say, we found the warning early. And that may be enough to change your future.